Hello, my name is Christina. My pronouns are she and her, and I'm a public health nurse with Toronto Public Health.
Hi, everyone. My name is Jennifer. My pronouns are she and her, and I'm also a public health nurse here at Toronto Public Health in the City of Toronto. So in August 2022, Toronto Public Health declared a meningococcal outbreak in the city. This video presentation will tell you more about meningococcal disease and how people can protect themselves by getting vaccinated. If you are between the ages of 20 and 36, Toronto Public Health is encouraging you to check your immunization record for the meningococcal vaccine. If you have not had the vaccine, then we encourage you to get one as soon as possible. The vaccine is free and available from your healthcare provider or at a city-run vaccination clinic. Appointments can be booked online at www.tphbookings.ca.
This video is being recorded on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And Toronto is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with the multiple Mississaugas and Chippewa bands.
On August 25th, 2022, Toronto Public Health confirmed 3 cases of invasive bacterial meningococcal disease in Toronto. The 3 people were between 20 and 30 years old, were not vaccinated against the meningococcal disease. They were born outside of Canada in countries that do not provide publicly funded childhood meningococcal vaccination. Sadly, 1 person died. Toronto Public Health has not been able to identify a link between these cases. However, all 3 people had the same strain of serogroup C meningococcal disease.
Meningococcal disease is caused by a bacteria called Neisseria meningitidis. Some people carry this bacteria in their throat or nose without getting sick. In some rare cases, the bacteria overcomes the body's natural defenses and makes the person seriously sick. Illness can include an infection of the brain, spinal cord, and/or blood, as well as complications such as hearing loss, brain damage, loss of limbs, and even death. Meningococcal disease can affect people of any age, but is most common in children under the age of 5 years old, teens, and young adults who are not vaccinated against the disease.
Meningococcal disease spreads through direct close contact with saliva from the mouth or mucus from the nose of someone who has the disease. It can spread through kissing, coughing, or sneezing, as well as sharing food, drinks, toothbrushes, cigarettes, lipstick, or other things that have been in the mouth of a person who has the disease. It can also spread by living in the same household with someone who has meningococcal disease. The bacteria is not spread through casual contact or by breathing air where someone with meningococcal disease has been. A person can spread meningococcal disease up to 7 days before becoming sick and until 24 hours after starting the appropriate antibiotic. Anyone who has been in close contact with a person who has meningococcal disease is at risk.
Symptoms may start between 2 and 10 days after being exposed to the bacteria, but between 3 and 4 days is typical. Symptoms include sudden high fever, severe headaches, stiff neck, drowsiness or confusion, nausea or vomiting, a purplish rash that spreads quickly, increased sensitivity to light, or seizures. The 2 images above are what the rash might look like. See a healthcare provider right away if you have severe symptoms, or develop symptoms within 10 days of being in close contact of a person who has meningococcal disease. Treatments include antibiotics, which can prevent you from getting very sick and spreading the bacteria. In some cases, the meningococcal vaccine may be used as well. Toronto Public Health follows up and provides guidance to anyone who lives in Toronto who's had the meningococcal disease and as well as their close contacts.
Meningococcal vaccine provides strong protection against specific types of meningococcal bacteria. You cannot get the disease from the vaccine because it does not contain live bacteria. The vaccine is safe and effective. Common side effects include pain and redness where the vaccine was given, headache, as well as feeling tired or unwell for a short time after getting the vaccine. In rare cases, serious allergic reactions such as trouble breathing, rash, as well as swelling in the throat and face may occur. Allergic reactions can be treated and are usually very temporary. There are no long-term side effects from this vaccine.
Toronto Public Health strongly advise adults between age 20 and 36 years of age who have not received a dose of meningococcal vaccine to contact a healthcare provider or book an appointment at a city-run clinic to get this free vaccine. If you got the meningococcal vaccine when you were a baby or a young child, but didn't get one when you're a teenager, we recommend getting the vaccine as soon as possible. If you don't know your vaccine history, then you should get the vaccine just in case, and it is safe to do so. The vaccine is free, even if you don't have OHIP, health insurance, or immigration status. A piece of ID is needed to confirm your age. You can get the meningococcal vaccine at the same time as other vaccines, such as flu or COVID-19 vaccines.
We're now going to talk about where you can get more information, including health and vaccine advice. Telehealth is now called Health Connect Ontario and can be reached by phone at 811 or through online chat. This free service connects you to a registered nurse day or night for confidential health advice. You can check your symptoms as well as get health recommendations and referrals. OHIP is not required.
Scarborough Health Network's VAX Clinic provides a one-to-one consultation with a doctor for accurate information about a variety of vaccines, including the meningococcal vaccine. This service is available by appointment for residents across Canada.
Thank you for watching. If you would like more information, please visit our website or call Toronto Public Health Hotline at 416-338-7600. We are open Monday to Friday from 8:30 a.m. to 4:30 p.m.